Hi, everyone. Welcome. Thank you for joining us. Happy New Year. My name is Dominic De Los Reyes. I'm the program coordinator for the Union of Pan Asian Communities program called Community Health Worker Communication and Outreach Services. We do COVID-19 education and help to share local county resources, especially to Native Hawaiian, Pacific Islander, Asian communities across the county that are more impacted by the pandemic through language and cultural, approachable communication. So, thank you for joining us tonight. This is a community engagement session on Zoom. We are live streaming on Facebook as well. Thank you to those who registered. And um, uh, we are also doing live captions. Thank you, Bayanihan Guevara, for your assistance with that. Also, thank you to Lori Bellama and Leah Brown for American Sign Language interpretation. So, yeah, it's a new year. We're all here. We're all still dealing with this pandemic, right? And it appears to be getting worse every day. So we just want to, hold space for questions, share updates from the county and links and resources, and really kind of explain what's going on, especially with the vaccines, and kind of jump into this all together. So. Um, Thank you as well for co-facilitating with me the community health workers Tracy Lee and uh, Jeanette Lucas. They specialize in the Vietnamese and Filipino communities in San Diego. So we're all here as a team to, just be together so we can um, do what we can to keep ourselves and our communities safe as we work through this pandemic. So we are funded by Live Well San Diego, and um, they have a vision for healthy and safe and thriving communities. And there are multiple community partners that have a grant from Live Well San Diego. So if you're looking for communities other than Asian Pacific Islander, we can connect you to other specialty community-based organizations that can also provide good, solid COVID-19 resources and information as well. Um, so we have some updated slides from the county that we can go over. Folks may have been already familiar with the messaging around prevention, right? We want to keep up the good work of following the the guidance, the public health order put out by the state of California, and also the county guidelines, right? We are in a stay-at-home order, um, and all of this documentation for that can be found at www.coronavirus-sd.com. I'll resume share. Hopefully you can see that on the screen share. So yes, and feel free to jump in as well, Tracy and Jeanette, as we get going. There's just a lot of resources and a lot of changes. These slides are from January 6th. And so we can try to fill in blanks around data and such, as we go through. But I just wanted to, there we go, January 6th, these slides. We can quickly go over transmission symptoms, but I think testing locations might be something for us to spend some more time on, as well as the data and vaccines. Right? Tracy recently got vaccinated, as our staff are now in the category of workers that are eligible to receive it. So we can talk more about that as well. And yeah, again, coronavirus, COVID-19, it's a virus that is also mutating quickly, and folks may have been seeing in the news some implications of new varieties of coronavirus, and there might be questions as well around what that might mean in terms of the vaccines we have. So feel free to post questions. For those of you who are in our Zoom chat as an attendee, you can type it in the Q&A box or in the chat. And we can also look at questions posed in the comments of the Facebook live stream. So let's make this a community conversation, right? And and we can tailor it to that, right? So those were the high risk groups. Here are reminders of symptoms that people who have COVID might not have any of, might have some of, might have a lot of, and check with your healthcare provider, right? If you are experiencing any of these things, and they can give guidance on what to do, next steps, getting tested for COVID. If you're in any of these high risk categories, it's also recommended that you get tested for COVID. If you don't have a healthcare provider, you can call 211 and they will connect you with one, regardless of whether you have insurance, right? COVID or coronavirus is different from the flu. Everyone is also encouraged to get the flu vaccination or immunization. There are lots of locations throughout the county that can provide you with that for free as well. And it is recommended to get both vaccines. They're different, right? So, the flu vaccine helps prevent the flu. COVID vaccine helps prevent COVID, right? And while you may be in the process of waiting for test results, if you got tested recently, you're encouraged to stay home or in a location where you can safely isolate yourself from others, right? Try to maintain good hand hygiene and cleaning the area around you. Try to have good ventilation of the space you're in, right? Because that's one of the ways that the virus passes is through respiratory droplets. So coughing, sneezing, talking, if it's in a contained space, more of those droplets will concentrate in the area, and people might be more likely to catch COVID from one another in this way. And at that coronavirus-sd.com website, we can also look up locations of testing sites. So please check out there, or also call 211. You can set up appointments at some places that require them. Others are walk-in, and there will be contact information for the locations, so you can call ahead and ask your questions, like maybe what would be the process of the test, and things like that. People who are not documented are also, should be able to get COVID tests and care for COVID-19 without, it threatening their status here, or without bringing upon you legal complications. For example, access to COVID care is not included in the public. I always forget the name of it. Can someone help me? The public, the laws around folks that have been changing recently, right? Quarantining is for people who have COVID. Isolation is for people who may have been exposed, or it's the other way around. I'm sorry. Okay. Treatment. We can pass over this for now because there's a lot of other things we want to focus on, right? We mentioned, physical distancing, keep at least 6 feet away from people, especially if they're not in your household or anyone who's sick. Um, the curfew is currently for the county is currently um, you need to not be in public between 10 p.m. and 5 a.m. And that's to discourage folks from mingling in person from different households. Um, and that's also why businesses where you can eat are closed for now as well, or not allowing you to eat there, basically. Only drive through and
To go.
yes, that's the word, delivery.
Yes, deliveries. And as for resuming back to physical, indoor and outdoor operations, they do not have an exact date. And so we have to wait for data to come in when the level of ICU reaches 15% again. And so that's when they will have more specific date for reopening, safe opening again.
Yes, that's right. Thank you. Okay, let's take a quick pause to switch the interpreters, and I'd like to share more what you're saying, Tracy.
I did not get that, Dominic. Can you repeat the
Oh,
question?
sorry. I just wanted to add to what you're saying
Uh-huh. Okay.
that because we have the stay-at-home orders in place, they stay in place for at least 3 weeks, and it's reviewed daily. Basically, the stay-at-home orders will stop once the capacity of healthcare facilities with the ICU units or the intensive care units, it raises above 15% capacity. Right now there's 0.0%, so like no beds in ERs and in ICU, right, are available because so many people are needing treatment for COVID that it has overwhelmed our healthcare capacity at this
And
point.
this is for southern region. So we San Diego falls under the southern region. And I know that the data was public that 1 out of 17 people in LA is COVID positive.
Yes, and we are in the same region as LA. There's, I think, 5 regions that California is split up into, and most of the state looks like our region as well. So it's very prevalent. And the strange thing about this, or maybe one of the reasons why there's so much um, disagreement on what's happening. There's a lot of reasons, but one of them might be, as suggested by Dr. Fauci in December 30th, is that uh, a lot of people know someone who has died by now from COVID, right? But there's also a lot of people who have gotten COVID and had maybe null or mild symptoms and have recovered from it, and it appears to not have had a big impact on them. So, however, what we're not seeing is unless people are healthcare workers, is if is how many more people are being extremely affected by it and have extreme symptoms. And there's a fast escalation in a lot of people too. More of the folks who pass are older, over 75, and or have other medical complications as listed in the high risk categories earlier. However, this is a virus that can affect all ages, and it is. And it's also affecting people at whatever level of health they have. Um, so it's can seem extreme that a lot of areas of our society are shutting down right now to as a response to try to minimize the risk of it spreading. However, we actually, I think, need to do more. Or let's just say the state is deciding, and also San Diego County, that we, oops, that we will continue to hold restrictions on the way we socialize in person um, until we get things more under control. Um, and I wanted to share a little more about indoor air ventilation, if possible. Um, uh, HEPA filters are helpful, right? You can also make air filters out of a fan and tape in a box. There are instructions that we can share. And there's also, y'all are gonna think I'm so nerdy. I got myself a carbon dioxide monitor, which measures parts per million. This is just one type that it can look like, and it doesn't have to be expensive. But they say if you want to get yourself one, and if you're able, the way to read it is the CO2 level, there should be a measure on there. And if it's under 600 ppm or parts per million, that means that your air should be good enough to have a minimal risk of, it's not still enough, basically, that you would need to um, switch out the air, or basically have a window and or a door open, some source of fresh air, especially if you'll be sharing a physical space with people who have COVID and people who do not, or people who do not live with you, right, or have been quarantining together. And try to keep that level under 600 if you're measuring it, right? Okay, do we want to go to vaccines, or do we want to look at any questions, or talk about the mental health side of resources available that Jeanette can share? Anyone? I don't think we have questions yet.
Well, I'll briefly talk about my vaccination experience from yesterday. And
Great.
so right now in San Diego, we're in tier phase A, 1A, tiers 1, 2, and 3 are being vaccinated right now. So if you fall below that, like that, those tiers, you can go into the San Diego website, the San Diego County.gov website, and click on the the vaccine information page, and it will lead you to the appointments page, and then you can sign up to be vaccinated at different locations. But all of the appointments, all 3 locations that are being taken up really quickly. And so I was on a waiting list, a few days ago, and so I was on all the waiting lists. And so I just wanted, so that's the key to getting to your appointment. I just get onto the waiting list, and immediately right after I was on the waiting list, I was being called and with an email with confirmation to come in on Thursday to get vaccinated. The location was in Chula Vista, and that Chula Vista location only giving out Moderna vaccines only. And so it was really quick. All you need is to go in and check in at the front, and then they will direct you into the clinic, and you will sign in, and then wait there to be called, and then you get vaccinated, your first injection. And then right immediately after your injection, you will be asked to stay back for 15 to 30 minutes for observation to any allergic reactions to the vaccine. And so a few hours later, you won't notice any symptoms or anything like that, but I noticed mild pain in the injection area in the upper arm of my left arm, and it was like 3 hours after the injection. So that's when I'm starting to feel like chills, a little bit of body aches, headaches, and so by 5 hours later, I was already in bed feeling like chills in my body, and I was having like body aches, muscle pain, and some type of stomach pain as well. And so those were the symptoms that I experienced last night. And around midnight, I was experiencing night sweats and mild fever. So I was like awakened like several times during the night. um, I'm still feeling like chills in my body right now. So if you ever had flu, it's so similar to flu symptoms. Yeah, and oh, I forgot about the headaches. You might get headaches, like pounding headaches, like I did. So it depends on each individual and their body and their immune systems. If you have a strong immune system, you will feel a little bit of tiredness, fatigue, and mild fever. But if um, so, it depends. It all really depends on your body.
Yes, thank you. And I've also heard, a lot of concern about in the decision whether or not to get COVID vaccinated. Common thing is concern about those symptoms, side effects, right? Does it mean that you got COVID when you got the vaccine? The answer is no. The vaccine is it's impossible to get the COVID virus from the COVID vaccine. It basically just gives a like fingerprint, enough of the a protein of it that allows the body to recognize vaccine and the virus, but not actually receive it. And so that's why the people can sometimes get side effects. So it would actually be a good thing, because when you get the COVID vaccine and if you experience the side effects, it means that your body is developing an immune response and developing antibodies so that if you get exposed to the real thing, it'll be ready and it'll be able to kill it. Right.
Exactly.
So it's not something to worry about. However, there have been rare cases where people get certain side effects that are severe. So it's also good to stay in touch, like you said, Tracy. I don't want to repeat what you said, but communicate with healthcare providers for any of your concerns. But we really want to encourage people to get the vaccine, especially since it's now, becoming more and more available. And on the share screen, and thank you for sharing your experience, Tracy. I'm looking forward to getting my vaccination on Sunday. I'm on a wait list, and if they call me, I'll get it then. And if not, I also signed up for an appointment on Tuesday at Petco Park. In the chat, I wrote for people who are unable to see it. CDC recommends giving the COVID vaccine in phases, which may overlap. So the first category of people is called 1A, and it's healthcare personnel and long-term care facility residents, right? And 1B is frontline essential workers, and that includes us, right? People who might be interacting with the public as part of their job, as well as people aged 75 years and older. And then 1C, people aged 65 through 74, and people aged 16 through 64. So in just the last few days, they have included more categories of people in the eligibility for the vaccine to accommodate for there being a lot of vaccines that have become thawed and ready for use. But the trick is that you can't freeze it again once it's been thawed. You have to use it. And people are seeing that those who are currently eligible have not chosen to get it for one reason or another. as much as was expected. So that means that, you know, as many more people as possible who want to, you know, can try to get it now at this point. The governor, I think, recently gave the go ahead to certain groups of healthcare providers who kind of took it upon themselves to go against the guidance and vaccinate people in groups that were not listed in the priority, just so that the vaccine could get into people before it expired. I hope that makes sense. Sorry, it was complicated. Um, oh, thank you for including the ingredients of the Pfizer vaccine as well in the chat, Tracy. Uh,
Yeah.
we also included the website for COVID-19 by California State. And that is, and you can get a lot of information from there, including a full breakout of this phases we started talking about. That's COVID-19. So the word COVID and then 19.ca.gov. That's the California site. And CDC, the Centers for Community, oh gosh, what is it? Centers for Disease.
Control and prevention.
There you go. It's Friday night, y'all. It's 2021. We're not even talking about what happened politically this week. You know, it's just COVID, and there's so much, right, for us to go over. Maybe that's a good segue to mental health. Jeanette, if you'd like to take over, and if not, you can throw it back to me as well.
Yeah, so if you do have any questions about the vaccine, you can ask me right now or after Q&A.
Okay, I'm Janet Lucas, community health worker for UPAC, and today I will share with you about the new resource that is now available in San Diego County. This is the text to 911. So if we are having emergency, there's another way to do it by calling 911 and also by texting 911. So I will share the screen so you can see where it came from. So I can share, Dominic?
Yes, you should be able to share. And if you're having trouble, I can also try to pull it up on my end. Just let me know.
Can you see that?
Yes, it works. Thank you.
Okay. So this came from County News Center. The new text 911 capability provides additional resource. So as I've said, this is already available in San Diego County, and this is announced and launched by the San Diego County Sheriff Department. This is a service that includes the Sheriff Department as well as all county fire and emergency medical services, EMS, agency, and will help to make the county safer. So the text to 911 technology is designed to help make emergency services available to some of the county's most vulnerable residents who are unable to dial 911 during an emergency. So according to the Sheriff Department, dialing 911 is still the fastest way to reach help in an emergency, but there are certain situations when texting may be a better option. So these situations may include being deaf, hard of hearing, nonverbal, or have difficulty speaking over the telephone. So the Sheriff Department also said that text to 911 service may be beneficial in a situation where it is not safe to call 911 for help, or if someone is having a medical emergency and is unable to speak. So to use the 911 text service, individuals needing emergency assistance should enter the number 911 to the to field of the text message, where when you send a message, you create a new message, you will put the number on the two. So on that field, you dial, you text 911, and then you provide the location and nature of the emergency in the body of the message, and then send the message. So the user should then respond via text to any questions the dispatcher may have, and follow any direction given in text format. So it is important for text to 911 users to remember that messages cannot include other people in the two fields, cannot contain photos or videos, and should not contain emojis, abbreviation, or acronyms. The Sheriff Department said it is also important for user to remember that the text to 911 is for emergency only, and intentional misuse of the system is a crime and is a punishable offense. Anyone who accidentally send a text to 911 messages should immediately reply clarifying there is no emergency. Currently, the service is only available in English. Data and message rates may apply. Since cellular services varies by location, if text to 911 is not available, the user will receive a bounce back message asking them to call 911. So I have a video that I can show you. So this is the
Text 911 is now available in San Diego County.
911 emergency.
Calling 911 during an emergency is still the best way to get help. However, there are situations when texting may be the better option. If you are deaf, hard of hearing, nonverbal, or have difficulty speaking. Or a situation when it's not safe to make a phone call. Enter the numbers 911 in the To field. Provide your location and the nature of your emergency. Text to 911 has its limitations. This service is only available in English. We cannot accept photos or videos. Do not use abbreviations, acronyms, or emojis. Text to 911 may be slower than a 911 call. If you add other people to the text message, it will not go through. Text to 911 is for emergencies only. Remember, if you have an emergency, call if you can, text if you can't.
Okay. So the implementation of the text to 911 technology will help improve the quality of life of all citizens and support the mission and vision of the San Diego County government to efficiently provide public services that build strong and sustainable communities as part of a region that is building better health, living safely, and thriving. So that's all, and I will put the link on the chat so you can go back and read the whole articles. Thank you.
Thank you, Jeanette. I'm hearing feedback and I don't know where. Oh, okay. Never mind. It's done. There's a question in the Q&A box. Do we know the impacts of the vaccination to vulnerable communities? I'm for vaccination, but I'm also nervous about my 5-year-old who is a Down syndrome child and was born with a heart defect, and myself with a heart condition. If there is no information on this just yet, where can we keep up with finding out as more studies come out on this with different conditions? Thank you for this question. And right off the bat, I would say discuss with your healthcare provider, and we can help connect you to one if you don't have one, because there are a lot of factors in deciding whether getting a vaccine for yourself or others who you care for would be the best decision. On the cdc.gov website, I copied in the chat as well. There's a page called 8 Things to Know About the COVID Vaccine. And I don't think I'm screen sharing right now, but perhaps I can real quick. It covers some of the most common questions. And that is one place where you can get some of the most updated information about the vaccine as it comes out.
And yes, Dominic, I'm sorry, cutting in. So the vaccine right now is only for, with Pfizer is, I believe is 18 and older, and Moderna is 16 and older.
Okay, so then that takes the question of children, or answers the question about the children. Children as young as 6 months old can get tested for COVID-19, though. So another place where you can get news updates, especially locally, is the County News Center, which is, let's bring you the link. One moment.
Here, I'm giving you the FDA .gov emergency preparedness and response to the Pfizer BioNTech COVID vaccine information. It will list all of the facts and information that you need if you decide to get Pfizer or Moderna.
Thank you. Both of those vaccines, I believe, have 2 doses as well. Correct me if I'm wrong. There's a slightly different time frame of between the first dose and the second dose, but they're about
Pfizer
a
is
month.
21 days. Pfizer is 21 days
Okay.
that you have to pace out, and Moderna is 28 days, which is 4 weeks in between. Yeah.
Thank you. And let's see. So the government plan is to, still encourage people who got their first vaccine dose to get their second dose. There is some talk here and there about whether the second dose should be extended past the original time frame that the manufacturers tested and recommended for people to get their second dose, for the sake of supply being available to more people, since there are distribution difficulties or unanticipated bottlenecks. However, it hasn't been studied what difference that might make in the effectiveness or other consequences of drawing out the time between the first and second dose, or if people only get 1 dose. However, in general, it takes about 2 weeks for people to develop immunity to COVID vaccine after they get their vaccine. So even after people get vaccinated, they are encouraged to continue doing all the precautions that they have been doing to give themselves that time to build up immunity. It's not like, the shot and then you're suddenly good to go. And also the vaccine is only one way to help prevent COVID, or to help deal with it. Let me find that slide on, there's like a cheese slices analogy where we want to layer multiple activities for us to keep ourselves as safe as possible, or to try to minimize the spread of COVID. Some of them are personal things we can do, and others are societal measures. So, and then, sorry, we're running out of time, but I wanted us to also talk a lot about mental health. One moment.
So the vaccination, the vaccine is not a cure. So just think of it as not a cure. It's just like a flu shot. It protects you from dying or from getting too sick.
That's right.
But then you still need to, take precautions like putting on a mask around other people. You still can get sick. You still can get the virus.
But it can help with being able to boost your immune system against it. Sorry, here's the cheese. I'm looking through all these slides for the cheese. Yes. So it's they're labeled like physically distancing, wearing face coverings, hand washing, hand sanitizing with at least 60% alcohol and doing it often. Cough etiquette, right? Cover your cough with the crook of your elbow or into a tissue and then wash your hands after using the tissue and throwing it away. Be mindful of, cross-contamination of surfaces, right? Avoiding gathering indoors with others not from your household. Avoiding touching your face. COVID testing is one of the layers, as well as quarantining after exposure. Ventilation, contact tracing, that's the infrastructure of support for people who got a positive test result for COVID test. And it's a way for healthcare providers to stay connected with you and connect you to resources, such as if you don't have a safe place to quarantine for at least 2 weeks, then, for example, there's the temporary lodging program. And there is a certain eligibility for that, but it is one of the things being used in San Diego County, right? And the vaccines as well. I also heard that California-wide, I don't know how local this is, but some of this temporary housing is becoming permanently available as well, since the pandemic is still something we're very much dealing with. Right? There are weekly county briefings as well. That you can get either from coronavirus-sd.com. You can text COSD space COVID and then 19 to the text line. It's 468-311. There's also, for people who have smartphones or Androids and iPhones, you can activate an exposure notifications thing that's already on your phone. It doesn't track your personal data, but it lets you know whether you may have been exposed by tracking also other phones that have this activated to see whether people have been in proximity, to kind of help with data gathering for contact tracers. To get a list of people who might need to be notified if they may have been exposed. If, for example, you get exposed to COVID and then it incubates for like 2 to 14 days, and you may not have any symptoms, and you may not have been keeping track of who you might have come in contact with. Say, for example, if you have to go to the grocery store. Then it helps with that, but it doesn't replace the contact tracing. Okay, sorry, I haven't been looking at the chat. Okay, mental health. Can we do this? There are crisis lines, crisis and access line. This is 24-hour. You can chat as well, and there's like an online website version of it. Live Well at Home has other resources. It's very easily to get, socially isolated with all the conditions around this. And we really want to encourage everyone to stay connected in ways that are COVID safe with the resources that you have. And it's not normal. These conditions are not normal. So if you are noticing worse mental health uh, for yourself than usual, it's important to know that there are resources available for you, and it's normal to like not feel okay about all of this because it's something no one is used to, and loss and grief is a real thing. Everyone deals with it differently, but people's experience with grief is valid, right? So we don't need to compare ourselves with others. There's no time frame. That's a funny thing about grief. It doesn't, it's hard to put into a schedule, right? And so if you need support, there is support. And UPAC, for example, also has other programs that can provide mental health support and other direct services, right? So please avail yourselves of it as needed. There's also Trevor Project for LGBTQ and folks in other warm lines and hotlines that we can share. Oh, and the Get Connected guide. So, Jeanette, you mentioned this earlier. Did you want to screen share again?
Oh, yeah, sure. This is from the Aging and Dependence, County of San Diego Health and Human Services Agency, Aging and Independence Services. So I'll share this screen. So this is the one that I read regarding the Get Connected, a guide to becoming engaged in the community. As we know, Age Well Resources, it addresses social isolation. So feeling a sense of connection and belonging is important for all of us and can possibly impact our health. So to help address social isolation, the Age Well San Diego um, social participation team created Get Connected. It is a guide. It's a page 1 to 15, and I will share it to the chat, the link. It's a guide becoming engaged in the community, especially adapted to be relevant during the COVID-19 pandemic. The guide provides resources and strategies to help you get connected, whether you feel lonely, want to build connection, to prevent loneliness, or trying to help someone you know becoming more socially connected. So when you want to access the guide, you will visit www.agingsandiego.county.gov, and then you click on COVID-19 community resources, and then social engagement. So in this uh, PDF file, so when you scroll down, you will see like the introduction, like the benefits of social connection, the social isolation versus loneliness, and who are affected, usually adults age 45 and older report feeling lonely. But it says here, if you feel lonely, you are not alone in your loneliness. So they have ideas to what to do, and they will show you like this one. It says loneliness and social isolation can be as damaging to health as smoking 15 cigarettes per day. So, and they have like what to do, like the first steps, like taking online class and learn something new, play online games with friends and loved ones, and then consider adopting a pet, learn about technology like the Zoom that we're doing, can use to make video calls, and like this one, overcoming challenges, like if you said I have an illness or disability, or the suggestion to overcome is the include a family member or caregiver when trying a new activity, or choose activity from the ways to engage list in this guide. So if you have I don't have transportation, call FACT Transportation Services at 888-924-3228, or ask a household member or friend for a ride and invite them to the activities. And there's so much more, like so this way, ways to engage, resources and ideas. So they have a listing of all the resources and ideas. As I scroll down, like volunteer, they have, helping older adults, provide transportation, and interfaith community service, safe and virtual volunteer programs that support the undeserved in San Diego North County, and a lot more, like health, fitness, and nature, and also technology tutorials. Those who, not familiar with Zoom or video calls, you can go to this link and search, or they have numbers, you can call them. So there's a lot. So home meal delivery, you can call this number on the right side of the screen. And yeah, the regular check-in mental health services like the NAMI, San Diego Access and Crisis Line, the friendship line, and also UPAC. We have a program about mental health. So that's it. So, like in the conclusion, it can take courage to reach out to others and try new things when you feel lonely or socially isolated. So the first step can feel intimidating, but you are not alone. It is important to remember that becoming socially connected is beneficial to your health and well-being. Giving back to your community, connecting with loved ones, or trying something new are a few of the many ways to share who you are with the world, and remember that you are valued. So that's for mental health, and I will just share the link on the chat so you can go over. Thank you, Dominic.
Thank you, Jeanette. Really appreciate that. I also want to share the UPAC website as well for a way to contact us, our program. It's upacsd.com. And right at the top, when you go there, it says COVID-19 response. One of the other food distributions available is every Friday from 1 to 4. You can sign up for care boxes, and we also include printed materials and resources with the food too. And then again, our program is Community Health Worker Communications and Outreach. Feel free to email us, call us, text. We will be having community engagement sessions like this twice monthly, usually first Fridays and third Wednesdays. And every now and then it might be in different languages, but with, accessible and English or translation, as well as guest speakers. In the past, we've had data specialists and healthcare professionals share. So keep an eye out for that, and you can register from this page. We also have PPE, personal protective equipment, available. So for example, small bottles of hand sanitizer. We can do virtual discussions in addition to these monthly. If you have any small groups of people that you'd like to engage with us, feel free to contact us to schedule that. We're very happy to do that. We can also go in person throughout the county. We're a program that is able to provide in-person support and connection to resources as well. Feel free to also check out our YouTube channel. It has all the recordings of our past virtual town halls, aka community engagement sessions, and as well as other informational material in various languages. So again, thank you for joining us. And we're about at time. Are there any last minute questions or comments? Oh, the drawing. I always forget. Oh my gosh. Okay. Sorry we didn't have this ready. We have a UV light sanitizing box that is big enough to be able to fit like a cell phone, maybe keys, and it kills germs with light. So for those who registered for this session, you are entered into a raffle, and it's Jeanette or Tracy, are you able to help me pull up that generator to pick names? I'll read the names of people who registered. There's not that many because
Yeah,
think,
can
We only have
you?
2 attendees.
Yeah, can I can put the names on the wheels so
okay,
we
let's
can.
do the wheel.
Yeah. So what's the name?
Clarita. Oh, did not come? Wait, let's look at who's on here. Dr. Candy and Enrique. Or Rick.
Dr. Candy.
Enrique.
Okay.
Thank you
Well,
all. We appreciate you. I'm gonna have to order more of these boxes. Clean everything.
so who else?
That's it.
That's it. Yeah.
So Dr. Candy and Enrique.
Yes.
Okay. Hold on.
Or it's spelled RIQUE in the list of participants. Here's our the list of our programs UPAC provides as well, and our contact information.
So I can
Also,
share. I can share screen now.
okay.
So only 2. Where's hold on. Enrique.
Red or blue?
Yeah. So Enrique or Dr. What is this?
Oh,
Hold on.
KNDI, sorry.
Yeah, hold on.
Well, Dr. Candy is a literal doctor. It's not
Oh,
DJ.
sorry. So here's it.
Spinning circles. she
So
is
Dr. Candy.
Filipina studies. All right. Thank you so much. Congratulations. We will mail it to you with contactless drop off.
Yeah.
Yay. Thank you everyone who joined us tonight, and feel free to
Bye.
reach out. Have a great night. Stay safe. Bye-bye.
Bye.
Bye.